Health disparities and their impact on underserved populations. Health disparities are differences in health outcomes and access to healthcare that exist among different groups of people. These disparities can have a profound impact on underserved populations, including low-income individuals, racial and ethnic minorities, and those living in rural areas. In this essay, we will examine the impact of health disparities on underserved populations, and discuss potential solutions to address these disparities. One of the most significant impacts of health disparities on underserved populations is the lack of access to healthcare services. Individuals who live in rural or low-income areas may have limited access to medical facilities, transportation, and health insurance, making it difficult for them to receive the care they need. In addition, racial and ethnic minorities may face barriers to healthcare access, such as language barriers or discrimination, which can lead to delays in diagnosis and treatment. As a result of these disparities, underserved populations are more likely to suffer from chronic health conditions such as diabetes, heart disease, and obesity. These conditions can have a significant impact on quality of life, and can also lead to increased healthcare costs over time. In addition, underserved populations may also experience high rates of mental health problems, such as depression and anxiety, which can have a negative impact on overall health and well-being. The impact of health disparities on underserved populations is also reflected in healthcare outcomes. For example, individuals from racial and ethnic minorities are more likely to experience high rates of morbidity and mortality for certain health conditions, such as cancer and heart disease. Low-income individuals are also more likely to experience high rates of infant mortality and lower life expectancy. To address these disparities, healthcare systems will need to take a multifaceted approach that addresses both access to healthcare services and the underlying social determinants of health. For example, healthcare providers can work to improve access to medical facilities and transportation for underserved populations, and can also implement initiatives to reduce language barriers and promote cultural competency among healthcare providers. In addition, healthcare systems can work to address the social determinants of health that contribute to health disparities, such as poverty, food insecurity, and lack of affordable housing. This may include initiatives to improve education and employment opportunities for underserved populations, as well as initiatives to increase access to healthy food options and safe living environments. Finally, healthcare providers can work to engage underserved populations in their own healthcare, through patient education and community outreach initiatives. This may include programs to promote healthy lifestyle choices, such as diet and exercise, as well as initiatives to increase awareness of preventive healthcare services, such as cancer screenings and immunizations. In conclusion, health disparities have a significant impact on underserved populations, including low-income individuals, racial and ethnic minorities, and those living in rural areas. These disparities can lead to a lack of access to healthcare services, as well as an increased risk of chronic health conditions and poor healthcare outcomes. To address these disparities, healthcare systems will need to take a multifaceted approach that addresses both access to healthcare services and the underlying social determinants of health. By working together to address these challenges, we can help to ensure that all individuals have access to high-quality healthcare services and the opportunity to achieve optimal health and well-being.